I'm Dr. Pedro Cosculluela. I'm an orthopedic surgeon who specializes in foot and ankle surgery. What we do is we treat conditions that take place further down towards the foot from the knee. We design a treatment plan so that you can get back to whatever it is that you want to do. Whether it's surgical or non-surgical, the plan is for us to get you back to doing anything, regardless of what it is. That can be parachuting, mountain biking, trail running, or just walking around the house or typing on your computer. The idea is that you do so in a painless manner in the way that you were doing it prior to you getting injured. I think the most common thing that we see is by far plantar fasciitis. It's the most common cause of heel pain. Most patients show up with a very similar story. Some remember a traumatic event like getting out of the truck and hitting their foot on the ground hard. In most patients, it's an insidious process that kind of shows up one morning when you get out of bed and you have bad heel pain. And then that tends to get worse and worse and worse. Fortunately, that type of condition goes away on its own over about 8 to 12 months. And also, fortunately, we don't usually have to do much about it other than stretching, better shoes, orthotics, anti-inflammatory medications, or Tylenol, and it tends to go away. The most common injury that I see is an ankle sprain. The two ankle ligaments are the most commonly torn ankle ligaments of all in our whole body, not just foot and ankle. And again, fortunately, 80% of patients do just fine with non-surgical care. That involves putting a patient in a boot, followed by physical therapy, bracing. We control their swelling with elevation and compression stockings. We do some ice, rest, anti-inflammatories early on. And in the vast majority of cases, patients are able to get back to their normal routine over 8 to 12 weeks. There's a small percentage, about 5% probably, that end up requiring some sort of intervention. That can be something on the simpler side like an injection, or on the more complicated side like surgery. And the surgeries that are offered for ankle ligament injuries are varied because we have to look at exactly what it is that's causing the pain prior to coming up with a surgical plan. A patient that comes to the office requires a certain amount of time. It's not established by me. It's based on what questions you ask me, and we make sure that we satisfy or satisfactorily answer any question you may have. Before I leave the patient's room, I make sure to ask them, do you have any other questions? I even came up with a list of questions to provide patients ahead of time in case they forget, because the one time you'll remember those questions are the second you get in the car as you drive away from my office. I'm always available to answer questions after the fact. We now have Athena where patients can reach out to me on the portal, and I answer those myself to make sure that they're happy getting all their questions answered so that they can make the best decisions regarding their care.